This is my presentation on public concerns with animal welfare in the research industry. So why are animals used in research? They're mainly used to discover more information and cures for human diseases. You can compare different procedures on identical animals, which you cannot do if you use humans or non-living organisms like cells or tissues. Some animals have biological similarities to humans, like pig skin, which is used for dermatological diseases, to study those, and monkeys to study polio. Going back to the procedures on identical animals, humans cannot be identical. In a lab setting, animals can be genetically modified to have the same exact genes as another animal. So you can have a whole big number of mice, for example, with the same exact genes, so they are genetically identical. This makes animals that are genetically identical an ideal model for research because different drugs or medical devices can be used on them and compared without any genetic differences being in the way. And with biological similarities to humans, pigs are also used for cardiovascular studies because they have very similar cardiovascular anatomy and physiology to humans. So most diseases are tested in vitro using cells or tissues before moving to an animal model, which is necessary before being passed in human medicine. So the FDA requires that something is tested successfully in a living organism before being used in humans, so not just in vitro, like using cells or tissues. And I'll talk about this later, having to do with GLP, which stands for Good Laboratory Practices. The FDA requires that GLP studies are done before a device or a drug is used in human clinical trials. So many facilities do breeding to keep certain genes in or out of the lab. This is called gene exclusion, depending on the type of experiments that they're trying to conduct. Certain genes are present or absent, and this can help their compounds work better. So what kinds of animals are used in research? Rodents are a big one. They're the main type of research animal used today. Non-human primates like monkeys, dogs, cats, rabbits, ruminants, fish, amphibians, reptiles, birds, and swine. So rodents, like I said, are the most common research model used today, and they have been for quite a while. And rodents can include mice, rats, guinea pigs, gerbils, hamsters, hedgehogs, chinchillas. So some studies that they're used for are formulating cancer drugs or oncology. They're also used for testing dietary supplements, infectious disease, diabetes, obesity, genetics, and more. So the reason that rodents are used is because obviously most of them are very small and they're easy to handle and maintain. You can hold several rodents in a facility versus if you have a facility big enough to hold 5,000 mice versus in that same facility you could probably only hold like 20 pigs. Rodents also reproduce quickly, so a lot of studies can be done with the same kind of line of animals, if you will, keeping those same genes in that line, which, like I said before, the identical genes are important for some types of research. Rodents are fairly inexpensive as well. Genetically identical rodents are all inbred, so that's how they keep those genes, the same exact genes, in the line. And then SCID mice are something that are used a lot. So SCID stands for severe combined immunodeficiency. So these animals have basically no immune system. They have no T or B lymphocytes. They're highly susceptible to most diseases and need to be kept in isolation in order to survive. The most common breed of mice that are used for SCIDs are bulb Cs. They're albino with pink eyes. SCID mice are particularly important in research because they have no immune system, so you're basically starting out your experiment with a clean slate. So you could put any kind of genes or any kind of disease in them without having any interference with antibodies or any other kinds of cells that would fight off anything because they don't have any of that. So moving on to non-human primates, they're the monkeys, and they are used for HIV studies. So with HIV in monkeys and chimps specifically, it will not progress to AIDS. So their researchers are looking at that disease in comparison to it in humans to see why the HIV virus does not progress to AIDS in monkeys like it does in humans, and kind of try to replicate that in humans, obviously, to slow down the disease or eradicate it altogether in humans. Vaccine development is also done in non-human primates. Obviously, if you look at non-human primates, they're the most similar to humans when you look at the whole animal kingdom. With vaccine development, this is mostly done in chimpanzees because they are the one type of non-human primate that is the closest to humans. They're also used for neuroscience studies, depression and anxiety, toxicology, nutrition, cancer, and dentistry. So they're very similar to humans. Like I said, they have similar brain structure and function to humans. So they're a very desirable species to work with because you can look closely at diseases in them versus us, and there's not much difference there. But if you look at the whole use of animals in research, non-human primates are only 0.33% of all laboratory animals used in the US, so they're not very common. Yet there's still a big controversy about why we use them at all. The main reason that it's so controversial to use non-human primates is because of how similar they are to us, and they have emotions and feelings like us. And some people think with them being so human-like, does it upset them to be used in research? Does it make it more dangerous for humans working with them because they're so much like us? And is it morally wrong to use them in research? And like I said, they can be dangerous to work with. Special training is required for technicians that do handle these animals because they can get kind of violent if they're not socialized. They need extra socialization with humans, and they also need enrichment in their housing environments when they're used in research. This can include TVs with shows or music on them, and then you should provide treats to forage for in their caging environment as well. The other reason that they can be dangerous is because they can transmit tuberculosis to humans that work with them. So it is recommended to use thick leather gloves when handling these animals, and this is also why extra socialization is necessary so that you don't end up, when you're working with them, getting bitten or anything like that, scratched, anything that can transmit the tuberculosis to you. The dogs that are used in research are mainly beagles and hounds. These breeds are used because they're docile, and when it comes to beagles, they're fairly small, so they're usually 20 pounds or under. They easily adapt to new surroundings. They're very easy to draw blood from when that's needed, put catheters in. They're very compliant and love to please people. They're a very well-known species as far as physiology and anatomy. The studies that they're used in are heart and lung disease, cancer, aging, orthopedics, toxicity. Using dogs in research, as you can imagine, is fairly controversial because people have dogs as pets. So there's more of an emotional connection, and for those technicians that work with dogs, it's harder for them to do the things that they could do to a mouse or a rabbit, say. Harder to euthanize them and do procedures on them because of that emotional bond that people have with their pets at home. And they don't want to do those kinds of procedures to the animals in the lab. Cats are also used. They have very close physiological characteristics to humans. They're used mainly in neurological and behavioral sciences. Cats in general can have a lot of neurological problems, so they're a good research model for this. They're used in studies for epilepsy, brain mapping, sleep research, hearing, balance, and movement. Using cats in research, as you can imagine, is also fairly controversial because they're a household pet as well, so it's the same kind of issue as dogs. The technicians can have a harder time doing procedures on these type of animals because of that emotional connection. Rabbits are also used in research. The main breed of rabbit used in research is the New Zealand white, so they're pure white with the pink eye, so the albino. So they're used in studies for atherosclerosis, ophthalmologic illnesses, serum antibody production, drug screening and testing, and orthopedics. Ophthalmology is a big one because they have such big eyes compared to the size of their head, so they're a good one to look at there. Orthopedics is another big one because they have a very similar orthopedic structure to humans, but they are very delicate compared to us. So the positives of using rabbits in research is that they're docile, non-aggressive. They don't ever bite. The most that they'll do is scratch if you're not trained properly to handle them. They're also widely available. And the negatives of using rabbits in research is that they're very delicate, like I said before. They can easily die under anesthesia just because of how their physiology is. Doing daily activities like cage changes or just cleaning in the room, if you scare them, if you bang something, they could easily have a heart attack and die. They're very, very delicate. You need to be specifically trained to handle them as well, so that if they do try to kick, it's very common that they can break their back if you do not hold them correctly. So when you pick up a rabbit, you're supposed to hold them by the shoulders and then support their rear end as well, so that they do not kick and break their back, because that's very common. They're also sensitive to light and dark cycles, and they don't always do well when waking up after anesthesia and during post-op, giving them pain medications or anything like that. They don't always last throughout a whole study like the researchers intend them to. Ruminants is another species that's used, so that's your sheep, goats, and cattle. The studies that they're used in reproduction. The sheep and goats are also used in fetal development. And then cattle are used in cardiovascular studies having to do with artificial hearts or cardiac assist devices, as well as toxicology. And then all three of those species are used in maintaining and enhancing farm animal health. So not just for the benefit of humans, but also for the benefit of their own species. As far as the fetal development studies, sheep and goats have very similar fetal development to humans. They have a very vascularized placenta, so that's why that's a good model to use, or they're a good model to use in research. And for the cattle using cardiovascular, they're used because of their cardiovascular anatomy and physiology is so similar to humans, just like that of pigs. So goats are typically used because they're so gentle and easy to handle and transport. They're very intelligent and affectionate. These animals are very social and easy to work with once they're socialized. The sheep are not as social, even when they are socialized with humans. So they do well as flocks or group housing rather than single house because of that. It's very easy to collect their organs once they are euthanized. Their body weight and size is similar to humans, and they also easily adapt to a lab environment. Ruminants overall are not widely used because of size. They would need to be housed on an actual farm setting versus an indoor lab setting to really thrive and get appropriate research results. So that's something that researchers think about when they're trying to develop what model they want to use for their drug or device that they're trying to do a research experiment on. Fish are widely used in research as well. The studies that they're used in are endocrinology, bacterial diseases, genetics, toxicology, pharmacology. The main species that's used for fish is the zebrafish. That's the one that's pictured above. The surgeries on fish is actually really interesting because, fish live in water, and for surgeries they can't be in the water. So what they do is they place them on the table out of the water, and they have to continuously run water over their gills to keep the oxygen flowing through them and keep them breathing. They're also very sensitive while under anesthesia, so they need to be monitored very closely during surgery. And obviously, especially with zebrafish, they're very delicate and pretty small. Most species of fish are pretty small to work with. Fish are also another species that can have its genes altered to be identical to one another for study purposes, just like rodents. So that's another reason why they're an ideal research animal. There's also an increasing interest as a hobby to have fish and own fisheries. So fish are being used more in research because of this increasing interest. So research is being done to benefit the fish rather than just the humans because people are keeping them as pets more. Amphibians are also used in research, such as frogs, toads, and salamanders. They adapt well to a lab environment, but this environment does have to be well regulated because amphibians are sensitive to humidity and temperature changes. The studies that they can be used in are genetics and physiology, such as motion sickness and space travel, because bullfrogs and leopard frogs are very similar to mammals in the fact that they can vomit. They're also used in studies for neurology, endocrinology, and developmental studies. The African clawed frog is a type of amphibian that can reproduce year-round with hormones. The same species is also used in molecular biology because their oocytes are used for developmental and genetic studies in toxicology. So if you think about, most amphibians reproduce externally, so the female excretes her eggs and then the male excretes the sperm, and they meet up externally in the water typically. So this species is an ideal species to study reproduction in because it's not invasive. They can just take the zygotes because they're already external and there's no invasive surgeries involved with this. Limb regeneration is also studied in salamanders, and then pharmacology, substances secreted from the skin. So amphibians are a type of animal that secrete oils and such from their skin. Drugs are sometimes inserted into the amphibians, and studies are done on how much of the drug is excreted from the skin in an amount of time or what have you. So the most common breeds of amphibians used in research are the African clawed frog and western clawed frog. These are fairly large frogs. Reptiles are also used in research, but they're less common. They're used in studies for pharmacology. So researchers look at snake venom enzymes and biochemicals in that snake venom. Studies are also done on fang and venom pouch anatomy. Comparative physiological studies are also done on reptiles. The reason that reptiles are less commonly used in research is because special permits may be needed to use them and to capture them in the wild. There are some breeders that breed specifically for research. Reptiles are also very sensitive to environmental changes like amphibians, so they're not as desired of a species to work with as well. So the type of species that are used: tortoises, turtles, crocodiles, alligators, snakes, and lizards. Birds are also used in research. They're used in studies for neurobiology, behavior, endocrinology, nutrition, microbiology, and embryology. Most are specifically bred for research and not wild caught. So you have your 4 types of birds that are used. Galliforms, which are your chickens, turkeys, and quail. Columbiforms are your pigeons and doves. Passeriforms are your crows, sparrows, and finches. Then your citizens are your parrots, cockatoos, and budgies. Swine are very widely used in research, mainly because of their similar anatomy and physiology to humans. They're used in studies for exercise physiology, nutrition, atherosclerosis, diabetes, transplantation, surgical training, toxicology, reproduction, and pharmacology. Domestic swine and miniature swine, like the mini pigs or micro swine, are mainly used. The one pictured here is a Yorkshire pig. They're the main breed that's used in research as far as the domestic swine. And then mini pigs and micro swine, the main breed that is used are the Gottingens. The mini pigs were specifically bred for research because they are very small. So when you look at the domestic swine, like the one pictured here, the Yorkshires can get up to 300 pounds once they're adults, and they grow up very quickly. The pigs are very social, and they're better when they're housed and socialized by humans. They're very easy to work with, but they're super vocal, especially when feeding, so ear protection must be used during feeding time. And positive interaction is key when you're working with pigs. So the guide is a book that was written for people in the research industry to kind of guide them in how to care for using animals in research. It has a wealth of information. Some people call it the Bible of animal research. It gives you guidelines and standards on how to house animals, how many you can put in a certain enclosure if they're at a certain size. It gives you information on sedation, anesthesia, and post-op care, all of the medications that are used for all of those things, humane euthanasia, and enrichment for each species, how to train your staff, occupational health and safety, vet care, how to procure animals and transport them, all the way up to the plant design, like how to blueprint your research facility. Facilities can get an ALAC accreditation. ALAC is an institution that will come in and accredit animal facilities that are complying with local, state, and federal regulations. So it's completely voluntary by the facility, and they come every 3 years so that you can keep your accreditation. So it's basically a group of volunteers that come in and walk through your facility to look at your animals, their health, number of animals per cage. They'll look through your records. They'll ask about your feeding schedule. They'll ask to look at records of studies going on in facilities, read through SOPs, look at past audits. They'll look at every single detail about the facility to make sure that it's following all of those regulations and rules. And if you pass that inspection, then you're accredited and you'll get better business at your institution from researchers. You'll be more attractive to those researchers because you're ALAC accredited. So the AWA, IACUC, and GLP. So the AWA is the Animal Welfare Act. It uses the animal welfare regulations, which is enforced by the USDA, the United States Department of Agriculture, and APHIS, which is the Animal and Plant Health Inspection Service. The AWA is legal standards for warm-blooded vertebrates used in research. That's all of your warm-blooded vertebrates, except for birds, rats, and mice bred specifically for research, as well as farm animals intended to be used as food or fiber. The IACUC is the Institutional Animal Care and Use Committee. This is a committee that all animal research facilities must have. It ensures that the animal research program is in compliance with all laws and regulations, etc. And they do a semi-annual facility inspection, very similar to what ALAC does every 3 years. The IACUC must have a chairman and at least 2 other members, being a veterinarian, public member representing the community, and a practicing scientist. The IACUC must report to the institutional official on all affairs. They read through the IACUC and make sure that it all looks good, like everything's going to comply with all regulations and whatnot. They'll ask questions as needed about details and then send it back to the researchers. The researchers then write a protocol, and that gets sent back and is basically a more detailed version of the IACUC that was approved by the IACUC committee. And that would go ahead and start a study. GLP is good laboratory practices. So these are regulations that apply to animal and non-animal research funded or reviewed by the FDA and EPA. GLP studies validate research processes so that it can be reconstructed. GLP studies must happen and be successful before something can go onto a clinical trial and be tested on humans. So that's another reason why animals must be used in research before anything is used on humans. With GLP studies, many more rules are followed than on regular studies. GLP studies have to have regular audits done to make sure everything is being done according to the protocol. So these are some of the groups and organizations that are against animal research. So the People for Ethical Treatment of Animals, or PETA, that's the most well-known organization against vivisection. The New England Anti-Vivisection Society, National Anti-Vivisection Society, American Anti-Vivisection Society, Anti-Vivisection Coalition, Negotiation is Over, Primate Freedom Project, and Stop Animal Exploitation Now. These are just some of the bigger groups in the U.S. These groups are general animal activists. They focus on the state of animals' well-being in production, research, and entertainment industries. They focus on the killing of wild and domestic animals, and they work through public education, cruelty investigations, research, rescue, legislation, and campaigns to put out their message to stop animal use in research. And their main goal is to have researchers use non-animal models instead, like the tissues and cells like I talked about before. These next couple slides are mainly why it is important to use animals in research and how they are not treated poorly. They don't suffer because of all the regulations and rules that I spelled out earlier. The main goal of all researchers in a facility is to make sure that all of the animals are in good health and are being taken care of on a daily basis. After working in the animal research field for over 2 years now, I know from firsthand experience that the animals used in research are not treated poorly. Any suffering is alleviated immediately regardless of the study endpoint time. So if an animal is sick or dying, it's immediately euthanized so that it is not suffering for no reason. Not to mention, if the animal is dying, it's not going to be a viable research model for the study any longer. All animals are examined in the facility at least once daily for any health issues, morbidity, morbidity, or death. And I've worked at 2 research facilities. This is no different in any research facility. The vet staff is always on their toes about all animals' health status and quality of life. That also goes for the research technicians or anybody working one-on-one with the animals. All procedures are done as painlessly and safely as possible. Any issues with staff non-compliance, abuse, etc. is immediately reported. There's something called a whistleblower's policy that is enforced in all animal research facilities, where if anyone feels that an animal is being abused by a certain person, or if somebody's doing something that could harm the animals, that there is an anonymous way to report that. The clean to dirty rule is followed all times. So what that means is any animals that have less of an immune system, their rooms are entered first in the day, so that when you leave their room and go to a different kind of strain of animal that's more dirty, you're not introducing anything from the quote-unquote dirtier animal to the quote-unquote cleaner animal. That's just the terminology that's used in most animal facilities, but you never want to go from a dirty room to a clean room. And if you are to backtrack, you're to change out your PPE, which is your personal protection equipment that's typically worn in every facility to protect you and the animals. All animals must be housed within guidelines spelled out in the guide in order to ensure that they have plenty of space to eat, drink, sleep, urinate, defecate, play, groom, etc., and be happy. Social housing is the norm for all facilities and is carried out whenever possible, which is in most cases. So when inspections are done, like the ALAC inspection or the IACUC inspection that's done twice a year, social housing is a big topic of discussion usually. Inspectors see this as an important aspect of living for all research animals, and as long as animals are not aggressive or fighting, most are kept social housed throughout their time in research facilities. And all animals also must have some form of enrichment, so that means some kind of toy or something that they can interact with other than their cage mate or what have you, just to keep them entertained. So the animal activist groups, with PETA being the national leader, all have an extreme opinion about animals being used in research or in captivity in general. So if you go to their website and look at their pictures or their videos, everything is very, very extreme, to the point where they're showing pictures from only the poor facilities that don't comply with all of the regulations that I mentioned earlier. Animal activist members believe that all animals should be free from any kind of captivity, so that includes your dogs in your house, cattle in the pasture up the road. They believe that everything should be free, no matter what. They also choose to only post pictures and videos of captive animals in horrible living conditions, like I said earlier, leading ignorant readers to believe that all captive animals are treated this way. So animal activist groups' mission in general is to go out and find the worst animal research facilities or the worst farms in the country or in the world and exploit them as the norm for all of those facilities, which is completely wrong and why they have so much publicity. Groups like the Primate Freedom Project argue that animals, like non-human primates, have emotions and feelings similar to our own, which should make it morally wrong to use them for research. While animal activist groups' goal is to convince researchers to use non-animal models for research instead, there is undoubtedly valid reasoning behind using animal models. Non-animal models cannot produce reactions to antibodies or disease like an animal can. Devices and drugs cannot be used in humans if they have not been tested in a living organism first, because it needs to be known that the device or drug will work in a living organism. How would it be known that it works if it's not tested in a living organism first? The people in these animal activist groups do not have experience or prior knowledge like research technicians or anybody that's worked in a research facility do about the research industry, and therefore will continue to spread the biased, ignorant lies of what they think all research facilities do to animals.